Hey guys, welcome and welcome back to this YouTube channel, or welcome back to this channel. In case you are clicking or you are bumping into this video for the first time, kindly subscribe. Guys, subscribe. You're doing a good job. Like my video, comment, share. Don't forget to turn your notification bell so that every time I post a video, you will be the first person to be notified. So guys, I want to talk about something that has been neglected by most of the people, or the whole world is not talking about it, and that is mental health. Okay, you find that even at this century, there are some people who still believe that mental health is something to do with bad omen. It is something to do with punishment. It is something to do with how do you say, rogi, or it is something that people really believe that if you have any problem with your mental, or if you have a mental condition, you are cursed, or you are, or they are performing rituals on you or something. In Africa, people usually just came up with things which they just, I don't know, but it's okay. Let's talk about it, and let's see what it is and why some people may suffer from mental health and some people may not suffer from it. We will look at some of the conditions that are related to mental health. We will look at the causes or predisposing factor, perpetuating factors, and many others. And also we will look at how can it be treated. By this time, I think that one we will talk about it when we are talking about, when we are tackling the specific conditions of mental health. So stay tuned if you want to know more about mental health in this channel. It is not going to be only one video. It is going to be separated into sections so that you get to understand what it entails. But today I'm just going to talk about the overall view of mental health. So let us define mental health, how World Health Organization define it. So mental health is the capacity of an individual to form harmonious relationship with others and to participate in or contribute constructively to changes in the social environment. Yeah, did you get that right? Yes. So that is how World Health Organization define mental health. Of course, we have so many definitions about mental health that people are coming out with, or according to everyone's perception, but let us just stick to that what World Health Organization has given us. So what are the consequences of mental illness? What are the consequences? What can cause? Did I get it right? What are the consequences of mental illness? Number one is poverty. Poverty is one of the consequences of mental health. At this point, you know what poverty is, and I don't need to explain about that. Poor living condition can be another form of consequences. Also, violation of human rights is also another one. Physical abuse is also another one. Sexual abuse, neglect, among others that you may list if you want to list others. Okay, how do we say that this person is mentally healthy? Who is a mentally healthy person? That is the question we're gonna answer at this point. How will you know that this person is mentally okay? The first one, this person is not at war with self. This person is free from internal conflict. You know, we sometimes usually have internal conflicts. Everybody has some internal conflicts that they usually go through. But if you're mentally okay, you don't have any internal conflicts within yourself. The next point, or the next how can we tell that this person is mentally okay, is this person accepts self and others. They accept themselves. They don't see themselves as a different person. You get that this person, even if he's physically disabled or physically challenged, let me say, put it like that, they accept it the way it is, and they can relate with others without any problem. They don't see that as a problem. They don't see that as something that can hinder them from doing any other activities that a normal person usually do. So if you accept yourself and you accept others, that means you are physically okay. Sometimes when I usually watch some videos and you go through comment section, you get some you get some comments that are so hurtful, so hateful, and so hurtful. Like someone is physically challenged, and the comment that someone is putting out, you can really see that this person is not mentally okay. The next point, this if you want to know that this person is mentally okay, is that they have the ability to cope and tolerate stress. We know that each and every person, everybody in this world has ever suffered from stress. Anything that disturb your mind, anything that disturb your body, that is stress. And if you can cope with it, or you can tolerate stress of any form, then you are mentally okay. And another point is that if you want to know that this person is mentally okay, is that they are able to form close and lasting relationship. They are not those people who, if they have friends, they disagree with the friends and then they do away with them. They can, even if they have they have disagreement in that their relationship, they can solve them and continue with their friendship for several days, several years. Yeah. And these people also can make sound judgment. They can make sound judgment. How do we know that a person can make a sound judgment? For example, if you give a normal person a scenario like the house, for example, maybe the house is burning and you have money and you have maybe a baby inside that house, and you ask this person, what will you save first? What will you save first from the burning house? Somebody who is mentally okay will say, I will save the baby first. Somebody who is not mentally okay will tell you that I will get inside and even burn myself there with the baby plus the money. Some of them will say, I will save the money first. So if you can make a sound judgment, that one we will consider you as someone who is mentally okay. Another point is that if you are mentally okay, you accept responsibilities. Yes, if you are mentally okay, you accept responsibility. For example, you are a dad and you don't want to pay fee, or you don't want to take responsibility for your children. We will consider you as someone who is not mentally okay, because you're supposed to take responsibility. Why are you not taking up the responsibility? If you're not taking up the responsibility that you are supposed to take, we'll consider you as someone who is not mentally okay. So taking up accepting and taking up responsibility is something that is very important. So if you accept responsibility, we consider you as someone who is mentally okay. And then the next point is that you view life in a positive way. Yes, even if there is a problem, even if there is a stress, even if there is challenges, you still have so many reasons to view life in a positive way. And if you are such kind of person, then you are mentally okay. Yeah. And the last one is that this person has good control over their own behaviors. You can't say that you are, when you see a child, you go rape that child, and you want to give reasons that are not even making sense. You are mentally not okay. Yeah. If you kill someone, we will view you as someone who is not mentally okay. Most of the time, if someone has killed someone without any reason, in fact you should not kill somebody. But if there is a case, or there is maybe an accident has happened, and you have been brought to a mental hospital, we do assessment and we see if you are mentally okay, or if you are just someone who doesn't take good control of their own behavior. We will do mental assessment and you'll see, or we will know if you are okay or if you are not okay. Also, they are able to solve their own problem. They are able to develop potential and talents to fullest extent. They are also able to function normally in environment. I think I'm going to stop there for those points are enough to explain who is a mentally healthy person, or who is a mentally okay person. So the next thing we are going to look at how can we know that someone is mentally ill. How do you tell that this person is mentally ill and this person is mentally okay? We have already looked at those things that you can check and see if this person is mentally healthy. And now let us look at things that we can check to see if this person is mentally ill. Anybody who is feeling inadequacy or poor self-concept is someone who is mentally ill. Someone who are unable to cope with the environment, this person is mentally ill. Someone who is display poor judgmental, this person is mentally ill. Someone who does not recognize limitation, she doesn't know this is bad, that person is mentally ill. Someone who doesn't take responsibility of their behavior or does not take responsibility that they are supposed to take, that person will recognize you as someone who is mentally ill. Someone who exhibits a dependency need because of feeling of inadequacy, you are mentally ill. Someone who is unable to perceive reality, you are mentally ill. Yeah. So in short, we are going to say that the mentally healthy person is someone who accepts self, is someone who is self-reliant, and this person is also self-confident. Now, let us look at the causes of mental health, or mental illness. And the causes are divided into 3 categories: predisposing factors, precipitating factors, and perpetuating factors. I'm going to explain them in that category. So we have said we are looking at the causes of mentally ill person, and we said it is divided into 3 categories: perpetuating, predisposing, and precipitating factors. So what are these predisposing factors? Predisposing factors determine the likelihood of one getting a mental illness. Usually they are their adverse experience one undergo in early life. For example, drug abuse, one of them, physical abuse, sexual abuse, among others. Things that put you at risk of getting mental health in future. Those are the things that we will call predisposing factors. Okay, now let us look at these precipitating factors. Yeah, let us look at perpetuating factors. So perpetuating factors are events that take place shortly before the onset of a disorder. For example, loss of a job. When you are fired from your job, you get depressed, and depression is one of mental condition. So that is one. Another one is maybe drug abuse. You take drug, you get addicted, and you become drug addict. And drug addict is also one of the mental condition that we usually manage in the psychiatric. Then let us look at perpetuating factors. Now, here, once the disorder has been triggered, for example, you were physically abused long back. Now, at this point, you have lost your job. You have lost your job. You have gone into depression. Now, these are the things that will prolong the disease. You were physically abused long way back. Now you are at risk of getting mental disorder. Now we have those conditions that those factors that take place short, that we say that they are precipitating factors. They take place shortly before you start becoming ill. And for example, you have lost your job. That is an example that I'm giving. You have lost your job. Now you are into depression. Now you are into depression, and now these perpetuating factors, they are things that will prolong the disease. You are into depression and you are taking alcohol. What do you expect? The disease will not go away. It will prolong. Or maybe you are into depression and there are also other stress that are setting in. The disease will not go away. It will prolong. Those are the things we call perpetuating factors. Yes, I think now you have understood the predisposing factors, the precipitating factors, and the perpetuating factors. Apart from those categories, we also have some biological causes of mental illness, and we have genetic factors, we have physical illness, also we have the emotional factors. So under genetic factors, there are some diseases that you just have to inherit them from your lineage. Like Down syndrome is also one of the mental disease, and this disease you just have to inherit them. Or Down syndrome can put someone as at risk of or becoming mentally ill, and that disease, or Alzheimer's disease, we are going to talk about all these mental conditions. So those diseases, you just have to inherit them. We have physical illness leading to loss of mental capacity, and those ones, for example, malaria, or any conditions that maybe tamper with the brain. Those conditions also can put you at risk of getting mentally ill, or putting you at risk of becoming mentally ill person. And also we have emotional factors such as anxiety and neurotic personalities. This can cause people to develop psychosomatic factors. Yeah, so those are some of the biological causes. We have also looked at those categories, the perpetuating, the predisposing factors. In case you have questions on them, you can write in the comment section so that we can explain it further for you, or I can explain it to you in a way that you will understand. Among other biological factors, we also have infection, which can cause infections and diseases that can cause mental illness, and also brain defect or brain injury can also cause mental illness. Yeah, I think those are the biological factors that can cause mental illness. And we also have physiological factors, and these are maybe neglect, poor ability to tolerate others. Physical factors that may contribute to mental illness include severe psychological trauma that a child maybe suffered when he was or she was still young. Maybe physical, sexual abuse. Those are some of the physiological culture that can put you or can cause mental illness. We also have social cultural factors that can put one at getting mental condition, and we have violence, unemployment, broken home, sexual abuse, among others. Social cultural factors that can put someone at risk of getting mental illness. Now let us look at factors that can influence attitudes towards mental health and mental illness. Factors: we have cultures, we have the health belief, we have religion, we have education. We have how education view mental health and mental illness. We also have how cultures view mental illness and mental healthy person. We also have healthy health beliefs, among others. Those are things that influence the attitude of mental illness. I think I've exhausted what mental health is and how I think I've explained like almost everything about mental health. But now, because we cannot just say that this person is mentally ill without giving any diagnosis. So we are going, in the next video we will look at the conditions under mental health. We have the bipolar, we have the mania, we have the what, we have so many other conditions. We have depression, we have anxiety disorder, we have personality disorders. We have so many other conditions under mental health. Those are the things that we are going to look at them in our next video. So guys, if you have not subscribed, I don't know what you are waiting for, or I don't know which content you are waiting for me. You are waiting so that you can subscribe. And in case you have any question, kindly write it in the comment section so that I know what so that I answer you. So let's stop from there. Let's meet in the next video. Let me get in the comment section the specific condition in mental health that you want me to talk about first in our next video. So bye till next time.